Dr. Turo, and it's been about a year since we did your laser cell signaling procedure for your arthritic knees. And a year later, how are your knees doing?
Well, it's at least it's pain-free. I thought that I didn't know what I was expecting, so I'm happy that I could walk back again. So that's the good part.
All right.
The reality is that I've gotten a little older too, so the reality is that I have other areas that I have to deal with. I've gone through other types of therapy during this time, so I think that I'm getting overall better.
Now, you were told that you needed a knee replacement in the past, right?
Oh yeah, they want to do both of them.
Yeah.
And I haven't done, and I really don't want to do that.
Well, let me show you your x-rays. I mean, look, you have, why would you do a replacement when we show you have cartilage space in your knees? I mean, this is a little thinner, but there is space. It's not totally bone on bone. You still have a little bow leg, but that's what the wedges are for.
Yeah.
And your orthotic, they made it thicker on the outside to push, biomechanically push those knees in. It's going to unload the medial knee joint. So, but the fact that, you know, the results we've had have lasted a year, you can walk. Did you say your walking's a lot better?
I would say that at least I can walk without pain.
Yeah.
And that's a good thing. Of course, I'm not walking as much as I...
Yeah, we were all in the lockdown, but now it's time to get out of the house and start walking more.
Yeah, I used to walk on a track, which was cushioned.
Yeah.
This is a...
But they closed the track down for 3 because of COVID.
Yeah, and so Laguna Beach High School has those beautiful cushioned track that I was able to walk for an hour.
Anyways, let's wait till the track opens up. I'm going to show you this new exercise called Katsu band training. It was invented in Japan, and it's a way to get more blood flow and release more growth hormone without having to use a lot of bulky equipment. And yeah, we'll give you a demo today. I think you're gonna like it.
Is that the stretchy bands?
No, it's something better.
Oh,
yeah,
okay.
They're pneumonic pumps. So we'll give you a demo today. Because yeah, your pain is under control. We just have to start strengthening your knees. So you start like climbing stairs, stuff like that.
Well, because we live on a 2-story house, so
yeah,
I do that. I always make sure I do walk up the steps.
Yeah.
You know, that's something I...
All right, so we'll get the Katsu demo. We'll give you like a shockwave just to keep the cells going. But yeah, after a year, you're doing great. Let's keep the results going. Congratulations.
Well, now this is the interesting device that you're talking about.
Yeah.
Is it definitely increases the blood flow?
Yeah, so I'll show you a video on that. So if you go to YouTube and you type in Katsu.
K-A-T-S-U?
Yep, Katsu training right here. And this is how it works right here. And I'll turn the volume up.
40 years of testing and research in Japan. Katsu training of today is a result of 40 years of testing and research.
Yeah, we'll give you a demo today on it.
Recently, research has been conducted at prestigious universities throughout the United States. Currently, in a practical setting, Katsu is used in fitness and rehabilitation throughout Japan. So what is Katsu training? Katsu is a method of training performed with special belts worn on the upper legs and arms to appropriately and safely restrict blood flow. The Katsu master works by using 2 compressors to inflate the belts. Katsu gives readouts in mmHg.
So here's how we strengthen the knee muscles.